Hey there, Doc J. Zimmerman here. How you doing? Today we're going to talk about shin splints. Now, shin splints are a big problem if you're a competitive athlete. It's that pain in the front of your lower leg that's nagging and it's sore, and it just really prevents you from running. I had shin splints really bad when I was playing rugby back in college. Thankfully, I was in chiropractic school at the time, and our anatomy class was discussing lower leg anatomy. And we happened to be talking about the shin, and the muscle over the shin, it's called your anterior tibialis muscle, and the function of that muscle is dorsiflexion. Its whole job is to take your foot and pull it upward like that. That's dorsiflexion. So when we were discussing anterior tibialis function, the clinical side of it was they said micro tears in the anterior tibialis muscle is what causes shin splints. So at that young age in school, I sort of thought to myself, well, if that muscle's tearing, why not strengthen the muscle and see how that would help with the shin splints? So at the gym that I belonged into, they had an apparatus where you stuck your foot into a sleeve and you put a plate on there and you raised your foot up and down, dorsiflexed your foot. And I started doing that and my shin splints went away. But prior to that, though, because the shin splints were in such pain, you had to come up with ways to help you get out of the pain. I'm not into taking anti-inflammatories because they damage other parts of your body, like your kidney and your liver. But there's things you can do for that. For instance, one of the best things is ice massage. I have this stainless steel ball in here. You stick it in the freezer for a couple hours, and then you can put it in here, and you can actually ice massage your shin and get that anterior tibialis muscle to calm down. So that's real helpful when it's painful. You get that muscle to calm down. You can also do some massage on it. There's plenty of instruments out there. This one's really great for the anterior tibialis muscle because it has this wide front. So you can get across the anterior tibialis muscle and just go up and down like that, get the blood flowing, get the circulation increased. It feels good while you're doing it, so it'll help get you out of pain. But the single most important factor is the training of the action, the dorsiflexion. If you can train that muscle and get it stronger, it's going to actually get rid of that pain, and it's going to prevent the shin splints from occurring. So one of the things that you can do, resistance bands are really popular. So if you have a resistance band, you can use that. If not, you can go to the local sporting goods store or the pharmacy and pick yourself up a TheraBand, which is an elastic band like this. And you can get them in all different sizes. And what you would do is you can cut one into a nice suitable length and then take it up here and tie it into a knot like so. And then you have it so it's like a band like this. And I'm going to demonstrate now because I have one on the floor. You need to anchor it. So in my office here, I have it anchored at the base of a table. You can lift up at your house at a leg of a couch. So you stick the TheraBand around one end of there and then one end around your toes like this. And then you pull back until there's tension. Get your leg straight. And get it so that it's really up at the top of the toes. Then you keep your knee nice and flat like this. And then you let your foot go forward into the plantar flexion and then back to dorsiflexion. Forward, back, and forth. Forward, back, and forth. Stabilize your knee. And you just keep going. Now the secret here is you want to keep doing the repetitions until it starts burning. You want it to burn, burn, burn. So it may take 20, 30, 40, 50 repetitions before you get that burn. And then once it really starts burning and you can't take it anymore, you just stop for a few seconds, count to 10, and then start up again and just keep it going. And then by doing that and getting it burned, doing 3, 4, 5 sets of making that muscle burn, you're gradually going to strengthen that muscle, and it's going to actually heal those tears and then prevent those tears from occurring. So that's why it's important to not only do the leg you have the shin splints in, but then to come and do your good leg too, because this way now you're developing the muscle. It's balanced. You want your muscles equally strong and equally developed on both sides, but now you're preventing shin splints from occurring on this side. So it's all about the dorsiflexion. You just keep doing this until it burns. And if you do that when you actively have shin splints, if you do it every day, you'll be in ice and maybe the massage, you'll see that the shin splints are going to go away fast. And then you can do the maintenance schedule with that, whether you're doing it once or twice a week, pre-season, and then during the season, to prevent the shin splints from ever coming back. I've never had shin splints again since that one incident where I learned about this muscle and how to take care of the anterior tibialis muscle. So for shin splint treatment, the bottom line, we'll go over real fast again. When you have the shin splints and it's active, you want to get the inflammation down, so use your ice therapy to calm everything, and then you could use your massage, your vibrational massage, to get the blood flowing to help speed the healing. And then you work on the dorsiflexion to develop the muscle to help the micro tears heal and to prevent the shin splints from occurring. So if you like this video right now, go ahead and give me a thumbs up and please subscribe to my channel. Thank you.